All right, today we are going to get a handle on a skill that is really the cornerstone of pediatrics, growth assessment. So why is this so important? Well, because it's not just about tracking numbers on a chart. It's the single most sensitive indicator we have of a child's overall health. Let's dive in and see how to get it right every single time.
So here's our game plan. We're going to start by clearing up some really common confusion. Then we'll define what growth actually is, learn how to measure and interpret it correctly, talk about what happens when things go wrong, and then we'll wrap up with the high-yield points you need for your exams.
Okay, first things first. Let's tackle the #1 mistake that students make right off the bat. So often, you'll hear people use the terms growth and development like they're the same thing. They are absolutely not, and for your exams and in the clinic, you have to be precise.
And this slide really breaks it down perfectly. Think of it this way. Growth is all about the numbers. It's quantitative. We're talking kilograms, centimeters. It's the how much. Development, on the other hand, is about function. It's qualitative. It's the what can they do? A child learning to walk or to speak. They usually go hand in hand, but they're two totally separate processes. For today, we're zeroing in on the how much, the science of growth.
So if growth is just about getting bigger, why do we call it the single most important vital sign in a child? Let's nail down a clear exam-ready definition.
I want you to think of growth like a mirror. It reflects everything that's going on inside a child's body. It's affected by nutrition, by hormones, even by their emotional state. And that's exactly why any little deviation from a normal growth pattern is such a critical sign. It's often the very first clue we get that something, somewhere, is wrong.
To assess growth, we've got to start with accurate data. The technique we use for measuring the human body is called anthropometry. And let me tell you, precision here is absolutely non-negotiable. Let's go through the correct methods for the key measurements.
For our littlest patients, anyone under 2 years old, we measure their length while they're lying down. This takes an infantometer, and ideally 2 people. One person keeps the child's head gently against the fixed headboard, while the other carefully straightens out the legs and brings the footboard right up to the heels. Now, the real key here, the thing you have to get right, is making sure those knees are perfectly straight. Now, once a child can stand up nice and steady, usually after they turn 2, we switch over to measuring their standing height with a stadiometer. And look at the posture in this picture. The child's barefoot, and 4 key points have to be touching that vertical board: their heels, their buttocks, their shoulders, and the back of their head, the occiput. This is how we know they're standing as straight as possible.
Head circumference is so important because it's our best proxy for brain growth, especially in those first few years. You're going to use a non-stretchable tape. You start at the most prominent part on the back of the head, that's the occipital protuberance, and you bring the tape all the way around to just above the eyebrows at the supraorbital ridges. You're trying to find the largest possible circle you can make.
So, we've got our measurements. Now what? What do these numbers actually mean? A single number in isolation, it tells us very little. The real story of a child's health, that's revealed when we plot these numbers on a growth chart over time. Let's see how that works.
Exactly. A single point on a chart just tells you where a child is today. But is that good? Is that bad? Are they growing well? To answer any of those questions, you need more dots. You need to connect them over time. The trend, what we call the velocity of growth, is so much more important than any single measurement.
Now, if you want to be really precise, and for exams you do, we use something called z-scores. A z-score tells us exactly how far a child's measurement is from the average for their specific age and sex. A z-score of 0 means they're right on the average. A score of -2, though, means the child is significantly smaller than their peers. This level of precision is why z-scores are really the gold standard. Okay, now take a look at this. This chart is exactly what we want to see. A healthy child usually finds their genetic sweet spot. Let's say it's the 50th centile, and their growth will just track right along that curve. They create their own channel. It really doesn't matter if they're on the 10th centile or the 90th, as long as they are consistently following their own line.
This, on the other hand, is the single most important red flag you need to be looking for. When you see a child's growth curve start to flatten out, or even worse, cross 2 of these major centile lines heading downwards, that's a huge sign of growth faltering. This demands an immediate investigation. It's screaming at you that something is wrong.
So what's actually going on when a child's growth starts to falter? Let's take a look at the common patterns of undernutrition and a couple of clinical scenarios that you're definitely going to come across.
All right, these 3 terms are must-knows. Wasting is when a child has a low weight for their height.
Think of this as an acute problem, something that's happened recently, like a bad bout of diarrhea. Stunting, on the other hand, is low height for their age. This reflects a chronic, long-term problem. And underweight? Well, that's just low weight for age, and it could be due to either an acute problem, a chronic one, or both.
Now for a really common clinical puzzle. You see a child who's plotting below the 3rd centile for height. Your first thought might be, okay, there must be some kind of disease process here. But hold on, that's not always the case. There are 2 very common and very normal variants of short stature.
Let's break this down because this is key. A child with familial short stature is just following their genetic blueprint. They're on track to be a shorter adult, probably just like their parents. Their bone age matches their actual age. But a child with constitutional delay, well, they're on a slower timeline. They're a late bloomer. Their bone age is younger than their actual age. But the good news is, they will eventually catch up and reach a totally normal adult height. The key to telling them apart, it's the bone age.
All right, let's pull it all together. Time to consolidate everything we've talked about into the most important high-yield points that you absolutely must remember for your exams.
First, never ever confuse growth and development. Second, always use the right tool for the job. Infantometer for the little ones, stadiometer for older kids. Third, remember, the trend, the velocity, matters way more than one single dot. Fourth, the most critical warning sign is seeing that curve cross 2 major centiles downwards. And finally, the key to telling the difference between the 2 normal variants of short stature, check the bone age. Delayed bone age means constitutional delay.
Okay, let's do one last super quick recap of the whole process, from start to finish. I want you to think of this as your clinical workflow for growth assessment.
It's really just a simple 4-step process. Step 1, know the basics, the difference between growth and development. Step 2, measure accurately. Remember, garbage in, garbage out. Step 3, plot that data carefully on the correct standardized chart. And finally, Step 4, interpret the trend over time. Look at the shape of the curve, not just the last dot you plotted.
And I want you to remember, this skill goes so far beyond just passing an exam. When you accurately measure, plot, and interpret a child's growth, you are acting as a guardian of that child's health. You are the person who can spot a problem early and literally change a child's entire life trajectory.